I want to take you to yet another story. In West Africa, the global health system is unable to handle another mass epidemic like the Ebola outbreak in West Africa. That's according to the medical charity Médecins Sans Frontières. MSF says that latent slow international response, the absence of solid leadership, as well as the lack of treatments and vaccines are a recurrent scenario in many of today's health emergencies and are not unique to the Ebola epidemic. As countries like Sierra Leone and Guinea continue to fight to attain Ebola-free status, a number of organizations are working to help them find the most effective treatment for Ebola. Among them is the Andrew J. Young Foundation. And for more on that effort, Ambassador Andrew Young, the chairman of the Andrew J. Young Foundation, joins us live from Atlanta, Georgia. Ambassador Young, welcome to Africa 54.
Well, very good. Glad to be with you.
Yes, it's been a while. Now, you have been so involved in so many things in Africa. Tell me how Ebola particularly kind of got your attention and kind of engaged you.
Well, if you'll excuse me for being very blunt about it, when the presidents of African states came to meet with President Obama, one of the doctors that came with the president of Senegal is a friend of mine, Dr. Badosa, and he has an organization, Prometra, Promotion of Medicine Traditionale. And I've been working with him for the last 10 years on trying to find the relevance of traditional healing and diagnostics to modern day problems. And so I asked him almost playfully, I said, what did you all used to do about Ebola before white folks got it? And he said, well, I don't know whether it was the same thing, but we have had our approaches. And I said, would you give me, he's very protective of the traditional knowledge. And he's a Western trained physician, but his grandparents were traditional healers. And I said, no, I don't want to know what they taught you at France. I want to know what your grandfather would have done.
Exactly.
And he said, well, there are certain herbs they used to use. I said, would you give me a box of those herbs? If you will ship them to me, I don't know what they were, but we shipped them to Morehouse Medical School, and they made an extract out of it. We sent that extract first to the Center for Disease Control, but they didn't have any live viruses at the Center for Disease Control, but they did at Fort Detrick, Maryland. So we sent the extract, and they sent us back 15 pages of medical data, which I can't understand.
Yeah. Now, Ambassador Young, were you surprised that while Ebola has been in this world for several decades, nobody really seemed to have been seriously making vaccines enough to deal with an epidemic?
Well, why would you make a vaccine if you have a society that will prevent it? See, I think the difference between Western thinking and African thinking, and I'm back and forth between, is that they will prevent the disease, and they will help the body to be strong enough to deal with the disease. What they found in Fort Detrick was that every time they put this extract in any of the viruses of Ebola that have been discovered anywhere in Africa, it had a stunting effect. And we've seen that time and time again. Now, if you go back and look and remember, Ebola only occurs as AIDS occurred after the famine in Ethiopia and Sudan and Uganda. Then all of a sudden in the Uganda, HIV emerges. It was after the Diamond Wars and where the blood diamond fights were going, where people stopped farming. People stopped eating their traditional diet. And I think that the best thing to do with all of these diseases is to make sure that one, we can keep peace, but that we also realize the value of nutrition. And it's much easier, much less expensive to prevent a disease than it is to cure it.
Yeah. Now, Ambassador Yang, how close are we, and particularly with your effort and the mission in West Africa, how close are we to getting a vaccine that works, medicine that works?
I tell you, I worked with everybody on a vaccine to stop polio, because polio got out of hand all over the world. But I'm much more interested in nutrition. I think these diseases can be prevented by a healthy diet, rich in protein, and also the amino acids and...
but that's the prevention part, but how about the treatment part, when it really happens?
But I'm saying that the treatment part is a good diet. That if people had high-level nutrition, much of their problems would have been prevented. Now, that doesn't mean that you don't have to cure it, but there are simple things. A group of African doctors here in Georgia suggested in Liberia that they add one capsule, adds selenium to the fluids that were going in. It cut the death rate at half.
Well, Ambassador.
Selenium, and when they ran out of selenium, the death rate went back up. So we got selenium off the shelves at Walmart, and you know, you can buy it in any store, and it's very inexpensive. And so I err in the direction of good nutrition and clean water. I said to President Bush when he put the $15 billion out for AIDS, I said, we would be better off if we took $5 billion for clean water, $5 billion for agriculture, and $5 billion for antiretrovirals. And I still believe that that's the only approach. You can put all the money on cure, but you got to prevent it sometime.
Exactly. Ambassador Yang, thank you very much for joining us today, and I wish you well. I know you had an accident and you're recovering. Thanks a lot for being with us. Ambassador Andrew Yang, chairman of the Andrew J. Yang Foundation, speaking to us live from Atlanta, Georgia. We want to know what you think about Africa 54 and the stories we covered during the conversation on Facebook. The address is Africa 54, and check out our headlines 24/7 on voaafrica.com.